My copay is what? And not only my patients say that, I say that because I can't believe how much people are paying out of pocket for copays. Timidar authorized, but only covers 50%. Patient responsible for $2,500 for their 42-day cycle. So somebody who's newly diagnosed with a more aggressive brain tumor, goes on chemotherapy and radiation, they're having to pay $2,500. Timidar authorized, but has to pay 3 different copays for the Timidar. Each copay is $75, $225 for 12 months. I have no insurance, how can I afford my medication? I want to go back to the Timidar authorized. Anyone been on Timidar here or know of Timidar? Timidar chemotherapy is based on your body surface area, so it has to be pretty exact. So other medications like your blood pressure medication or heart medication, they might be able to round it up to the next tablet. Like say there's a 37.5 milligram dose and then there's another dose, and that to get those 2 doses, even though you need 2 tablets, they might be able to round it up because it's not going to really affect, because it doesn't go by size. Timidar is based on your size, so it's pretty exact. So if your dose is 155 milligrams, it would be a 100 milligram tab, 2 20 milligram tabs, and 2 5 milligram tabs. That's where the copays come in, so you have to pay. So we were trying to, I got hit very hard with a bunch of patients that had this type of copay problem. So I happened to be talking to someone who's in the TV world and got me to talk to somebody from CBS. No one wants to touch insurance because it's so employer specific, so that the employers are paying out $7,000 maybe for that year for that Timidar, so $225 a month isn't that bad. You know, so, I mean, it's bad for the person paying it, but looking on the whole, they feel it's not that bad. So no one wants to tackle that problem, but I think it is a problem, especially in our economy, that people are paying $225. And I can't even blame the insurance company. It's the drug marketing and how they're making these drugs that are costing a lot of money. And if you have no insurance, what do you do to pay for your medication? One, every hospital has charity care of some sort, so you can apply for charity care from the hospital. That's for testing purposes, but for medication purposes, most of the time having to go to other resources like the company. Timidar, anything that's brand name is pretty easy to go to the company, and you just have to have qualifying. Some are a little higher, other, total income $100,000, some are a little lower, depending on the company. The most common that I work with are Tarceva, Timidar, Avastin, and they're all pretty good. Zofran is in generic form, so it's very difficult sometimes to get the generic, to get the medication. And I just got a letter saying that Zofran is no longer supplying a patient assistive program. And the generic on the Zofran isn't that cheap either, depending on which pharmacy you use.